Good morning, everyone. Welcome to Grand Rounds at the UCSF Osher Center for Integrative Health. My name is Shelley Adler, and I have the pleasure of serving as director of the Osher Center. Today, I am absolutely delighted to welcome you to a session with our wonderful guest speaker Dr. Candy Tsourounis. Dr. Tsourounis earned her Doctor of Pharmacy degree from University of Illinois in Chicago. She's a professor of clinical pharmacology here at the UCSF, in the UCSF School of Pharmacy. And she also serves as a drug use management supervisor for UCSF Health. She contributes to the Department of Clinical Pharmacy's Medication Outcomes Center. And that is a center that conducts medication-related research and also evaluates pharmaceutical models of care to improve patient outcomes across UCSF, across our health system. Throughout her career at UCSF, Dr. Tsourounis has been passionate about studying dietary supplement use and safety, and educating both the scientific community and the public about risks and benefits of supplement use. And I can't resist a personal note of thanks here for Candy, who, in addition to her wonderful work and research, is a really brilliant teacher and has participated in some fourth-year medical school courses that I have taught, and is always I think the model of evidence-based and engaging and practical information sharing. So thank you so much for being with us. After the presentation, we're going to have about 15 minutes or so for discussion. Please submit your questions through the Q&A feature at any point during the presentation. And lastly, before we begin, I want to thank my fellow Grand Rounds Planning Committee members, Selena Chen and Patty Moran, Yvette Coulter, Julia Burns. Now, please join me in welcoming Dr. Candy Tsourounis.
Thank you so much. It is a pleasure and an honor to be here today. What I hope to do is to provide you with a very broad overview of dietary supplements. And while you might say to yourself, there's literally thousands of them, that is true. There's no way that I could cover any, component of the dietary supplement world that exists out there for consumers to purchase. But what I thought we could do today is to talk about the importance of labels. And while that seems very obvious and simple, I hope to share with you examples of how looking at a label, interpreting a label, can really help direct how we interact with patients and how we educate patients on making the right choices. And so the other thing that I wanted to share is that I am not an expert in Chinese medicine or in herbalism or in any of the other important practices. My perspective is looking at these products through the lens of commercially available dietary supplements. And so this is sort of the framework that I'll be working within. And feel free to educate me as well on anything that you feel I should know in that area. I'm always learning and willing to expand my knowledge base in other areas. So today's presentation is largely centered around three objectives. I'd like to just talk a little bit about the supplements that have come across my practice, but also to talk about some regulatory gaps that we still have and that are presenting questions for us as a community, as healthcare professionals. Talk a little bit about the labels and organize our approach at looking at labels, and I'll walk you through some of those important components, and then just talk about structurally how to think about herb interactions or drug-herb interactions, and sort of keeping in mind resources that are available both for you and for patients. So I think it comes as no surprise that many patients are using supplements, and this is one of the most recent statistics from the Council of Responsible Nutrition. 74% of US adults report taking supplements, and this includes vitamins to single ingredient and multi-ingredient products. In addition, 55% of the general population consider themselves to be regular users. And these statistics are here really just to demonstrate that it's really important. I know for this audience, we probably all ask our patients, but for the average practitioner, it's really important that you question patients about their use. And a strategy that I like to use is whenever I'm meeting with patients, I ask them to bring every medicine bottle that they have in their home, put it in a bag and bring it into the appointment, because what that allows me to do is to look through their supplements, their prescription medicines, their over-the-counter medicines, topicals, pretty much anything that they have in their medicine cabinet, so that we can go over them together. In addition, the other important thing that you might want to be aware of is just where people are buying supplements from. And you can see here on the right that most often it's from merchandisers like Target and Walmart, but also we're starting to see more and more of the pharmacies, the Walgreens, CVS's, but Costco is one of my personal favorites for supplements. Although granted, you get the giant size, but they tend to do a pretty good job of purchasing from reputable distributors, reputable manufacturers, and then, of course, the vitamin shops as well, where many people go to buy a lot of the combination vitamin products. And so you can see the statistics here. I have this slide here not to explain to you how dietary supplements are regulated, but rather to just remind everyone that yes, dietary supplements are indeed regulated under the Center for Food Safety and Applied Nutrition, and that usually I can assess someone's knowledge of the dietary supplement space simply by hearing them say one thing. If I hear anyone say that dietary supplements are not regulated by the FDA, I immediately know that maybe they're not very well informed on how supplements are regulated. As my teenage daughters say, that gives me the ick. And usually that is how I can assess someone's familiarity with the space. And usually I can tell in a published news story or in an article or an interview. If somebody says that, then I can understand that maybe I need to help educate them on the fact that, yes, they are regulated. The other important thing that I am bringing up is sort of what we all know, and that is that the Dietary Supplement Health and Education Act is what oversees dietary supplements and the regulation of supplements. What is really critical to remember out of all of this that's listed in the definition is that dietary supplements are intended to be taken by mouth. And I'll give you an example where I had to use this just yesterday. I was contacted by a reporter who was asking about intravenous vitamins. And they were asking, well, it's a dietary supplement. And I said, no. Intravenous vitamins are not dietary supplements because by definition, they're to be taken by mouth. So an IV vitamin would not be regulated under DSHEA. And in fact, they are not. Intravenous vitamins are not regulated under DSHEA. They have their own category. And also they are subject to other regulations, including compounding regulations and various others under the state regulations. So I include that in there because it's really important to always go back to the definition when you're thinking about how to manage supplements and thinking about who oversees them. The other important consideration, and that I try to make a distinction between when I'm talking to consumers, is we all know what constitutes a prescription medicine. That's pretty clear. We all know what is a dietary supplement, but then we also have over-the-counter medicines. And each of these are uniquely different in how the medicines come to the market, how they're regulated, and the expectation for the consumer. And so with prescription medicines, we know that the FDA considers a new drug to be unsafe until it's proven safe through clinical trials. With over-the-counter medicines, the same can be said, but we also have another level that the over-the-counter medicine must meet, and that is that a patient or a consumer would be able to self-diagnose, self-treat, and self-manage the condition. And so there's a lot of unique regulations to that, but you can see where a lot of the over-the-counter medicines that we have fall in under those three areas. And then, of course, dietary supplements that we're all familiar with, where the FDA considers a dietary supplement to be safe until it's proven unsafe. And that is the unique difference between supplements and prescription and over-the-counter medicines. And that's sort of the take home, and I try to educate patients on that as well. So what are the labeling requirements? I have them all listed here. And while we may all be familiar with these labeling requirements, I'm going to provide you with some labels, and we're going to talk about why these things are important in a few of these to give you some real world examples that you can work through when you're evaluating a supplement, whether it's appropriate for a patient or not. Some things to remember: the percent daily value is critical to have an understanding of. And that is established by the NIH related to essential vitamins and minerals that have an established dietary value, dietary intake. Importantly, directions for use is critical, because if something were to go wrong with a particular supplement and someone has an adverse outcome, the first thing that you would want to know is, were they following the expected directions for use or the expected dose? And then we're going to talk about some of these other elements in a minute. So I know this is a busy slide, but I'd like to work across it really briefly. So one thing you'll know is labeling is important, right? And we see different types of labels for different types of products. So for foods, we all know what a nutrition facts label is. If we've ever looked at the caloric content or the carbohydrate content of a product we were buying, we could see here that this is what a nutrition facts label looks like. Over on the far right, we have the over-the-counter medicine label, and this one has a lot more information. Granted, it's in like 2-point font, but what this does is it immediately highlights the active ingredient within a particular over-the-counter medicine, so you know what the active ingredient is. You can also see warnings on the label, as well as how to use the product and what the expectations are in terms of side effects. In the middle is the dietary supplement label, and you'll note very quickly that we don't have side effects or warnings listed on dietary supplement labels. But what I do want to call out is between the two dark bars here in between, usually the manufacturer will list all of the essential vitamins and nutrients that have established daily values. And so you'll see here vitamin A, vitamin D, we all know those have recommended dietary intakes, and from that, the percent daily value is established. Beneath that section, you can see here that in this example, omega-3 fatty acids are listed, and it has a sort of a dagger here, and it says that daily value has not been established. And that's because we don't really know the exact amount of omega-3 fatty acids that should be in our diet in order to preserve health. We have some expectations around that, but there are some but it's not as clear, right? And so when you see herbs listed on a dietary supplement label, you will note that the herbs tend to be listed down here because there is no established daily intake or daily value. So here's an example of another element that has to be on a label, and that is this concept of a proprietary blend. Consistent with what I described earlier, you'll see here that we see that vitamins are all listed first, and you see that they all have a percent daily value because the vitamins and nutrients are essential to our health and well-being, and that's why they have a percent daily value. And then down below, we have this proprietary blend. And a proprietary blend, as we all likely know, is really a combination of ingredients that each manufacturer has determined it makes their product unique. And because they want some exclusivity, they don't want to share individual amounts of each ingredient. And so DSHEA allows them to add up all of these unique and individual ingredients and sum their total net quantity in one number. And here you can see this proprietary thermodyne complex is listed as 1,415 milligrams, which essentially means nothing. It has no pharmacologic meaning. It really tells us nothing, to be honest. And because adding up these individual ingredients that have nothing to do with one another is really not helpful. But what it does tell you is that there is a proprietary blend in the product, and we can see in this example that there are that this proprietary thermodyne complex is the one in this particular blend. This is another example of another supplement. Again, going back to the concept, we see the essential vitamins and nutrients. The niacin is listed with a percent daily value. And then the Xantrex proprietary blend has some really interesting ingredients. I'm going to take a look at the chat here. So is there anything in this proprietary blend that stands out to you? Please feel free to put it into the Q&A, I believe, and just go ahead and type it in and let me know if there's anything among these ingredients that would be of concern to you if a patient were to select this product. Okay, so I see there is a question here. I'm going to take it at the end. Does anyone else have any observations about the other ingredients in this blend? Are there any similar pharmacologic properties that these ingredients might share? Yeah, caffeine, maca root, caffeine, yes. So surprisingly, all of the pretty much the first 5, 6 ingredients all have caffeine-like properties. We can call it that, right? Stimulant properties. The yerba mate, caffeine is listed outright. Guarana, damiana, which is a diuretic, acts as a diuretic. Green tea can have catechins and ECGC that can have caffeine as a part of that. Kola nut is also a caffeine-containing herb. So essentially, what is happening here is very quickly you can see that the top 5 or 6 ingredients have a lot of stimulant-like properties. So separate from, say, someone sipping a cup of coffee in the morning, this is a pill, two capsules to be exact, that someone might take and then not be prepared for the caffeine bolus that might happen. And so separate from, say, sipping coffee or sipping tea over time, you would ingest these pills and get a very high peak immediately of the caffeine properties. And many people feel very uncomfortable with that, especially if they're sensitive to that caffeine. And so what I'm trying to share with you here is please read these labels carefully and appreciate that sometimes they will share similar pharmacologic properties. In this example here, whenever I look at a blend, I start to focus on the top 5 or 6 ingredients because those are the ones that are going to be present in the largest amounts, because that is what DSHEA requires of a proprietary blend, is that they're listed in the order of predominance within the supplement. So here, yerba mate, caffeine, guarana, damiana, green tea, all of those, kola nut would be my top concerns, is that this product might have more caffeine than the person bargained for. Some manufacturers do a nice job of putting on the label equivalent to 2 cups of coffee, equivalent to 3 cups of coffee, but not all do. And so really important to know that. Okay. So I'm not going to go over structure function claims too much, but just to know that under DSHEA, supplements can link a dietary supplement ingredient to how it impacts the structure or function of the body. And so examples here are, that antioxidants will help maintain cell integrity, or that glucosamine supports healthy joint function and cartilage. But they can't say that, say, glucosamine will improve your osteoarthritis pain or will lessen it. And so it's really important that these structure function claims, if they're being used, the FDA says that you have to have this disclaimer on the label as well, that that the FDA does not review these claims in advance. And I'll show you an example of this in the next slide here. And so here's an example where we have my highlight here is not aligned, but it says antioxidant helps boost the immune system. And that is a structure function claim describing how this antioxidant is going to impact the structure or function of the body, in this case, boosting the immune system. And then down below, you can see here, very, very small font, it says these statements have not been evaluated by the FDA. And importantly, these structure function claims can be used, and you just have to notify the FDA. So it's not like the FDA reviews these before a supplement comes to market. And so important to remember that and to keep that in mind. If you've ever watched any infomercials that are marketing a supplement, the FDA disclaimer is usually at the bottom of the screen in 2-point font, and it goes by quick. You may not even see it or know what it is when you're watching the ad. Let's see here. I'm going to keep going. Okay. I'm going to answer a couple of the really good questions that are in the chat in just 1 minute. So which of the following are structure function claims? St. John's wort supports emotional well-being. Glucosamine increases joint mobility. Coenzyme Q10 reduces systolic blood pressure. Omega-3 fatty acids promote healthy vasculature. Melatonin supports healthy sleep. Vitamin C cures the common cold, or calcium increases bone mineral density. Does anyone want to take a guess at which one of these, and you can put the number in the Q&A, which one of these would you say are structure function claims? And the ones that are not structure function claims would be considered drugs, or either prescription drugs or over-the-counter drugs. And that distinction is important because that would mean that it would be characterized as a drug because it's intended to diagnose, treat, or prevent disease. But here what we're focused on is structure function claims. So I see 4. Actually, 1, 2, 4, and 5 would all be structure function claims. St. John's wort supports emotional well-being. You're not saying that St. John's wort treats depression. You're saying that it supports well-being. That's a structure function claim. Number 2, we're not saying that glucosamine can treat osteoporosis or excuse me, osteoarthritis. We're not saying that glucosamine can reduce the severity of an osteoarthritis flare. We're saying that it increases joint mobility, structure function claim. Omega-3 fatty acids promote healthy vasculature. We're not saying that it can reduce the risk of heart attack and stroke. And then melatonin supports healthy sleep. That too is a structure function claim because we're not saying that it will reverse insomnia or cure insomnia. The other ones are considered to be drug claims. So vitamin C cures the common cold. That should be pretty clear. We can't say that it diagnoses, prevents, or cures disease. And then calcium, that one is a bit of a challenging one, number 7, because that one would be considered a drug claim because it's sort of an exclusive exception to the rule that it increases bone mineral density, because that would be considered a drug claim. But that was really good. Thank you for your participation in the chat. So it's 1, 2, 4, and 5 are structure function claims. So someone earlier asked me, what does SE indicate? And SE stands for a standardized extract. So when we looked at that proprietary blend label, you saw that there were ingredients and it said SE after it. And that means that it's been standardized. And what does that mean? It means that there is um, uh, uh, a component, a chemical or marker that is in the plant that the manufacturer has standardized their product to. And we believe that standardizing it to that active chemical marker is somehow associated with the beneficial effects. And now let's just be clear here. There are thousands of components within a plant, and it is very difficult to know which component and how many different components maybe working together could constitute could result in the response we're looking at. But we believe that when we standardize it to that chemical marker, that it is associated with the clinical benefit that we're looking for. And so I have some examples here. You might see garlic that's standardized to 1.3% allicin or 0.6% allicin. That's one example. Or St. John's wort, standardized to 2 to 5% hyperforin or 0.3% hypericin. Those are the two particular extracts that are used commonly for St. John's wort. And I have some information down below only to say that hyperforin is a potent inducer of cytochrome P450 and can interact with a lot of different medicines. And I have that listed there for you. There is research now to suggest that low doses of a specific hyperforin extract might be devoid of that interaction. But when you're thinking about interactions with birth control pills or interactions with transplant medicines, I don't know that I'd be willing to take a bet on that low dose because of the consequences, which are very severe. There's also evidence that hypericin, the other extract, does not impact cytochrome P450, and that might be something that patients might consider as an alternative if they're worried about interactions. And so those two things I just share with you as an example as we are kind of thinking about how to avoid drug interactions. Okay. So here's a good example of a St. John's wort label, and I hope you've kept the previous slide top of mind that I just shared with you. And that has to do with the amount of St. John's wort that is standardized, right? So let's take a look at the left label here. In the left label, you will see that a couple things. First thing is there is no serving size listed up above. Sorry, there we go. No serving size is indicated. The serving size is established by the manufacturer, and this is and sometimes it's established based on the percent daily value as well. But remember, we're adding other things into the combination product. So again, that is established based on how much of the essential vitamins and nutrients are needed based on the percent daily value. And then the manufacturer determines how much of the herbs or substances that don't have a percent daily value they want the person to ingest. So in this example, there is no serving size, which is concerning. You also see here, it tells you that St. John's wort is in this product, and it tells you that the stem, leaf, and flower are the parts that were used in order to get the St. John's wort, but we don't know what extract is here. Hopefully on the front of the bottle, you might know if it's the standardized extract hypericin or hyperforin, but it's not very clear here which is in this product. The middle label, some observations here. Good news is we have the serving size. We also have our essential vitamins and nutrients here that have a percent daily value. And then down below, you'll note that the St. John's wort is the dried extract. You see the parts of the plant where it came from, and it's very clearly indicated as 0.3% hypericin, which is what we discussed earlier, which is a common standardization. It has some other ingredients here that you'll note, but the point here being that it very clearly indicated the extract that's provided. Here's another example. Good news is we have our serving size, and then also we see here that St. John's wort is the aerial parts of the plant that were used, and that it does list hypericin in here, and you would have to know that you would take this 2.7 milligram divided by 900 milligrams, and you would get the 0.3% hypericin, which is what we said is a common standardization for St. John's wort. So there's some understanding of what extracts are. There's a little bit of math sometimes in interpreting what the right amount is. Some manufacturers will have this information on the label, whether it be on the front or on the facts panel, and some will not. So you have to be very careful when you're evaluating what standardized extract you are looking for and buying. So now that we've talked a little bit about how supplements are regulated, we've talked a little bit about structure function claims. Here's a question for us to think about. Which of the following statements is true regarding dietary supplement regulation? A, that the supplement must be studied in a clinical trial for efficacy before being marketed to consumers. B, that FDA pre-approval is required for all structure function claims. C, that dietary supplements and drugs must list precautionary statements for use on the label. Or D, supplements and drugs can be pulled from the market if proven unsafe. And so if anyone has any, if you're feeling bold, I see some D's. Yes, correct. The answer is D. That dietary supplements don't require clinical trials for efficacy before coming to market, and that pre-approval by the FDA is not required for structure function claims. The manufacturer can submit them after they've already marketed the product, and that supplements and drugs do not have to list precautionary statements on the label like over-the-counter medicines do. So D is the correct response there. All right, a few words on calcium supplementation. I thought I'd just share something about interpreting labels on calcium. Obviously, I can't go over every possible nutrient, but I thought this one would be interesting to share with you, and that is that we know calcium is important across all life stages. Most of the time, we see it being used for osteopenia and osteoporosis and maintaining bone health. Important to remember that when you are considering a calcium supplement, to consider the absorption of that calcium supplement. For example, I tend to use calcium separately and not have it be a part of a combination supplement when initiating it. And that's because I have a lot more freedom to play around with the formulation and the dose to ensure tolerability. And so the main complaint that many women who begin calcium will say it's very constipating. And so the way that I work around that is I can play around with the dose, maybe change the formulation, to kind of help relieve some of that constipation. So using the chocolate chews, calcium chocolate chews or calcium gummies, some of those tend to be better tolerated, and then adjusting the dose is important. And the reason why I say the dose is important is because we know that for each dose, we want to keep that each individual dose less than 600 milligrams of elemental calcium to be able to absorb the dose. So if someone needed 1,200 milligrams of elemental calcium per day, I would break that up into 600 and 600, whatever time period is most convenient for the patient, not 9 a.m. or 12 a.m. or 9 a.m. and 10 p.m., whatever is right for their lifestyle. But that 600 milligram is the cutoff at which going above that, you're going to not be able to absorb that full dose. The other important thing is looking at whether the patient is taking a proton pump inhibitor or an H2 receptor, H2RA agent like a Zantac or cimetidine, some of these others, or they suffer from achlorhydria as older adults can sometimes suffer from a lack of enough stomach acid to absorb medicines. And so for that reason, calcium citrate might be the preferred form of calcium. And I know there's lots of them available now on the market, but for me, the calcium citrate formulation tends to be the better one to use for those patients. Now, one thing that you should note is that when purchasing a calcium supplement, the FDA requires, and DSHEA requires, that a product that provides 20% of the daily value for calcium would contain 200 milligrams of elemental calcium. And so what this means, a good rule of thumb is if you pick up a bottle of calcium, you can take a look at the label, and where you see the formulation, so whether it be calcium citrate, calcium carbonate, whatever the calcium form is, you look at the percent daily value and you add a 0 to that percent. And that will equate to the elemental calcium found in per tablet or per serving, I should say. So if the serving size is 2 tablets, then that would be what you would find in 2 tablets. I'm going to give you two examples just to solidify that fact, because I know it can be confusing. So on the left is product 1, and we see here that the serving size, is 1 tablet, and that the calcium formulation is calcium carbonate, and it says 600 milligrams. Now, we don't know if that's elemental or not, right? It could just be the total weight of the calcium carbonate. So we go over to the percent daily value, and we see that it is 46%. So we add a 0 to the end of that, and now that's 460 milligrams. That is the amount of elemental calcium, 460 milligrams, found in 1 tablet of this particular brand. And so that is a really nice way that you can simplify how you determine how much calcium to recommend for a patient. So if their goal is 1,200 milligrams, then you can make the calculation of how much of that 460 milligram per tablet they would need to take in order to achieve that. The other example here is for a different product. This is now calcium citrate. You see here that the serving size is 2 tablets. So for every 2 tablets, this calcium citrate would provide 540 milligrams because we're adding a 0. And so again, now you can determine how many of these tablets this patient would need to take. Keep in mind that there is no cutoff here, and every manufacturer will have a different amount. And so if you are struggling with finding a good product for a patient that can meet their calcium intake goals and that they don't have to take 3 or 4 tablets per day, this would be a really good way to look at those labels and determine which product would be ideal. Okay. I'm going to move on. Here's another, this is a real consult that I received through our Osher consults, and this is for vitamin B12. So this was an 81-year-old woman who had low vitamin B12 or was on the low end. You can see that there with some variability clearly in what a normal range is. And this woman required oral supplementation, but the patient was asking if they could use nutritional yeast to replace their vitamin B12 instead of taking oral supplementation. And so I received this consult and I started to look into this. And so on the right, you will note the label for the nutritional yeast. And if you go down to the very bottom, is where we see the vitamin B12 that's found in this product, and it says 15 micrograms is provided in 2 tablespoons, right? Because that is the serving size. So 2 tablespoons, 10 grams, will afford this person 15 micrograms. So what do we know? We know that typical oral supplementation is 1 to 2 milligrams per day. Not micrograms, 1 to 2 milligrams. Why are we supplementing so much more through oral supplementation? Well, that's because you have to replace stores before you can begin the input, output, the maintenance of your daily needs, right? So you got to replenish the stores, and that's why we use this higher dose. So when we look at what our regular recommended dietary intake for daily use, the amount is 2.4 micrograms per day. So again, when we're replacing in much larger quantities than what we need to get in a daily intake. So here you see with this yeast that 2 tablespoons contain 15 micrograms. So in order to get 1 milligram, which is what she would need to replace stores and to begin to correct the nutrient deficiency, this patient would need to consume an extraordinary amount of this yeast, which would not be tenable. And so in this case, the recommendation was to really work with this patient and get her to understand that it would be really hard to do it with the yeast. She could continue to use the yeast as part of her diet, but really oral supplementation would be the best way to meet her nutritional goals. Here's another example. I want to be mindful of our time here as we're getting close, and I want to have time to go over some of the questions in the chat. Omega-3 fatty acids is another one that I see a lot of mistakes being made in terms of how to dose omega-3 fatty acids. This is a 52-year-old woman who has type 2 diabetes and requires triglyceride lowering with omega-3 fatty acids. And the current recommendation for triglyceride lowering is 2 to 4 grams of EPA and DHA. And those are the two omega-3 fatty acid components. So how do we interpret that? Because her doctor told her to take 2 grams of an omega-3 fatty acids per day in order to help reduce her triglycerides. And so when we look at the label, we see here some interesting things. So first, we look at the serving size, and the serving size says that it's, 1 soft gel contains 1,000 milligrams of this fish oil concentrate. But then down below, it says it provides 300 milligram of total omega-3 fatty acids comprising of EPA and DHA. So what most people would do is they'd look at this label and say, oh, this has 1,000 milligrams, and if my doctor told me to take 2 grams, I'll take 2 soft gels. But the reality is that is incorrect, because we don't base the omega-3 fatty acid replacement on the fish oil concentrate, on the total weight of it. We base it on EPA and DHA. And what they've done here is they've added the EPA and DHA for us already, and have told us that EPA and DHA equal to 300 milligrams. And so how many soft gels would that be? It would not be 2 soft gels to get 2 grams. It would likely be 7 soft gels to get 2,100 milligrams, or 2.1 grams, a little bit over, but that's okay, because we're really basing it on EPA and DHA. And that's a mistake that I see commonly by patients and some providers as well, because it's really hard to interpret the labels and understand the facts here. Here's another supplement that I thought would be really interesting to talk about. So here is a combination weight loss supplement. And this was a 32-year-old woman who was interested in taking this. And the patient is healthy, has no other medications. And based on the label, what concerns do you have about this product? So first of all, you have to know all of these ingredients and why are they in this product. So you would have to know that manufacturers combine ingredients that have purported different effects. So you'll see ingredients that are supposed to regulate glucose metabolism, because obviously that's important for weight loss. You might see changes, ingredients that might work to increase our energy. So maybe like stimulants and caffeine. We might see ingredients that promote a feeling of satiety, feeling full. So here we'll see ingredients that act as a gel-like substance that swell in the gut when faced with, water or liquids. And so they kind of make you feel full. These are just some examples. And each of these ingredients here have a role to play, but it's really difficult for the average person to know why each one of these ingredients are added. But I will say, and I'll call out one of them. First of all, you might ask yourself, why in the world is glucosamine added here in this product, which is used for a lot of different reasons, but we know this mostly for osteoarthritic pain. We also see this other ingredient, glucomannan, and I'm using this one to demonstrate a common pitfall in these labels. Glucomannan is one of these agents that is a pectin and swells when exposed to water. So when you take this supplement, hopefully, the idea here is that it will turn into like a gelatinous substance, and it'll occupy space in your stomach and make you feel full, so you won't eat as much. But what is most people don't know, if you go to the literature and look up the literature on glucomannan, what you will find is that in the poorly conducted studies that barely show a difference, they did not use 200 milligrams. In those studies that we can argue are not effective, they used grams worth of glucomannan. So the fact that they're adding a tiny amount in this product is really nonsensical and irrelevant. In fact, there's no data to support such a tiny amount having any benefit in this combination product. And the average consumer wouldn't know that. The average provider wouldn't know that unless they spent time on PubMed searching up glucomannan trials. And so what this is an example of what the industry calls fairy dust amounts. So manufacturers would add very small amounts of other ingredients in these products in an effort to market to the consumer to say, look, we've added a little bit of St. John's wort. We see this all the time in menopause combination supplements. And they say, well, we've added some St. John's wort because we know that women may feel depressed during menopause and we want to boost their mood. But again, it's in these fairy dust amounts, very, very low doses that have not been proven to be effective for managing mood. Here, and I want to end on important mechanisms for drug interactions. Really, the most important one to remember is St. John's wort because it does have some significant interactions. Most other herbs might have some interactions, but they're easily overcome either by dose or some other variable by monitoring, adjusting, etc. And so the majority of our interactions that at least I see for patients is these are the pharmacodynamic interactions. And that means taking a supplement and a prescription medicine that share in the same pharmacologic property. So for example, taking melatonin along with a prescription medicine for sleep. Clearly, both of those share somnolence as the same property. And so taking them together, you might see an added effect. So those added pharmacodynamic interactions is what I most commonly see. I don't see that many pharmacokinetic interactions, although I would say drug absorption is probably one of them. And, clearly some of them have some cytochrome P450 liver enzyme effects, but largely it's really focused on pharmacodynamic interactions. And then lastly, I want to just be mindful of the time here. The most likely pharmacokinetic scenario of an interaction that I see is when you have a patient who has a dose increase of their prescription medicine and then begins taking an inhibitor. That other medicine inhibits the metabolism of the other drug, and now you've just increased the dose of the other drug, and that's when you can see pronounced pharmacokinetic interactions. And then, of course, I mentioned the pharmacologic profile, patient taking an herb and a drug with a similar profile. I have a list of some supplements to avoid here. These are supplements that are problematic. Anything that claims to be better than the FDA-approved prescription medicine, that is suspect marketing. Anything that claims that it doesn't have any side effects, If I see a supplement manufacturer that says it has no side effects, I'm immediately suspicious, because if you're taking a supplement to change something in your body to make you feel good, basic pharmacology dictates that it will change something in your body to potentially make you feel not good or have a side effect. Granted, the side effect might be very small or maybe negligible, but to say that it's devoid of any and all side effects is just not truthful. Anabolic steroids are supplements that claim to be an alternative to anabolic steroids is also suspicious, and you can see here the rest of them as I have them listed. So gaps within our framework, these are unanswered questions that DSHEA does not require. We don't know dose response studies for a lot of these herbs. We don't know how they affect pregnancy, whether they cross the placenta or not. Those things are typically never studied. We don't always know if these supplements will get into mother's milk or if they're be even harmful in mother's milk. These are just unanswered questions that our current regulatory framework does not help us with. And then how to select a product. If you see anything that says miracle cure overnight, it'll help you lose weight in 24 hours, these things are warning signs. Avoid any product that has any of that verbiage associated with it. And then, of course, I always like to recommend third-party testing, so supplements that have undergone some level of scrutiny for their purity and potency, which is very important. And also important, we have supplements that are ingested and they're packed so tightly into the pill form that they never dissolve. And one tip that I tell patients is just to take a cup of warm water. If you're suspicious about the product you purchased, drop that tablet in the cup of warm water, and within 30 minutes, if nothing has changed on that tablet, there's no bubbles on the border of the tablet, or that it has not dissolved in the water at all and it's still solid, that tells you that it's probably going to be solid when it exits into your stool. And so that might be something that you can consider as being important. And then I'll leave you with some general tips that you could read on your own. But lastly, we have some free drug herb interaction checkers that I've listed here. They're not perfect because, of course, they're free, but there's some that have some of the most common herbs in the drug interaction database, so you can search for those. They're not perfect. I have the limitations here. We did a spot check of all of these using some known drug interactions, and so you can see here fish oil was one of them, garlic was one of them, and we have some limitations associated with that targeted search that I have here for you. And then I'll leave you with some reliable information resources, so please consider that. And I know I have a lot of questions here, and so I'd like to take a stab at answering them. I saw someone had asked me to review the calcium tip again. So what you do with the calcium is you look at the percent daily value next to the calcium. You take the percent and you just add a 0 at the end. 460 would be the milligram, the elemental milligram strength of this particular supplement. So each tablet would provide 460 milligrams of elemental calcium carbonate. That would be the example here. In this example, remember that, my cursor, 54% would equal 540 milligrams of calcium citrate in 2 tablets, So that's the distinction. You always have to look at the serving size. Okay, let me go through some other questions here.
And Kenny,
Yeah.
Let me know if you want me to, or if you want to scan through.
Yeah, I so far so good.
Okay, good. Thank you.
Resources that I recommend to checking out a product. Okay. The most important thing that I will say about researching products is when somebody tells me, hi, I'm taking Optimum Health. Is that a good supplement? The first thing I do is I immediately go to the manufacturer's website, because most often I found that Optum Health or Optimum Health, there's probably 10 different formulations. There's Optimum Health Plus, there's Optimum Health Women's formulation, Optimum Health Fiber. So knowing the exact one is the first step, because then I can go to the label and I can look at the ingredients and then take those ingredients and search some more. And usually where I start is on this NatMed Pro that's on this slide, which is a subscription, but our library has this available for us, luckily. We are so lucky to have it. And you can search individual ingredients within NatMed Pro to learn about them. Now, not every ingredient is going to be in there. You might not know how much of each ingredient is in there if it's a proprietary blend, but you can focus your attention on the top 4 or 5 ingredients and kind of have a sense that maybe these are the ones that I should focus on because they're the ones in greatest quantities. Some of these, let me see, there was another one that I wanted to go over. So over-the-counter medicines and prescription medicines, there was a question about having them list precautionary statements. Yes, over-the-counter medicines and prescription medicines need to have precautionary statements on the label. And for prescription medicines, this includes like the medication guide that you might get when you go to the pharmacy to pick it up. Or if you go to the manufacturer's website, you can see, the prescribing information for patients. You can see the prescribing information for healthcare professionals, and that will have the precautionary statements. For supplements, we do not have any mandatory precautionary statements that are required. Remember that for supplements, all that we have that are required is really these elements. So there's really no precautionary statements. As I mentioned, some manufacturers do a nice job of adding precautionary statements because they want to do the right thing. So they may include the, equivalent caffeine equivalent to 2 cups of coffee. That would be helpful. There was, someone asked about CYP. So CYP refers to our cytochrome P450 enzyme system. I know that's a big, long term, but essentially these are enzymes that are in our liver that help break down medicines. And the cytochrome P450 enzyme system is a family of enzymes, many different ones. The largest of which you might hear is the 3A4 family. And the 3A4 family is responsible for breaking down and metabolizing, 50–60% of the medicines and substances we come across. And so if there's a supplement that affects the 3A4 enzyme system, that is one that we want to pay attention to. And that doesn't mean that you can never take a supplement that affects the 3A4 enzyme system. All that means is to let your provider know and to be mindful of the degree of the interaction so that you can adjust the doses of the medicine. There are some people who take interacting herbs and drugs together safely because you can adjust the dose to account for that. But you have to know that that person understands that interaction and will consistently take both as recommended so that you don't disturb that balance. I hope that's helpful. It's the example I use for consumers is that the cytochrome P450 enzyme system is kind of like a garbage disposal that can break down medicines quickly. If you turn it on quick, it breaks it down quickly and brings down the levels in the body. Or you can have the garbage disposal go really slow, and so the blood levels stay, but they slowly go down in the body. So that's my crude example. So another question is about examples of supplement interactions, as many people take multiple supplements simultaneously. That is why some of these drug interaction checkers can come into play. I get a lot of questions on the consult service about drug interactions. And what I do is I check multiple drug interaction databases to make sure that there is or isn't a drug interaction. And I know we're out of time here at 9, but I check multiple drug interaction databases to make sure. And then I also do a literature search just to see that there's no case reports or anything else that I need to be aware of. These were all very good questions, and I thank you all for your engagement. I hope this was helpful to you and that you learned something you can take away in your practice.
Thank you so much, Dr. Tsourounis. Yes, speaking from everyone, for everyone, absolutely enormously helpful and practical. Always a pleasure to have you, and thanks for the very interesting interactive aspect of the presentation as well.
Thank
Thank
you.
you very much. Have a great day, everyone. Thanks for joining us.